that at the end of the day, all of us will be blessed. In Jesus' mighty name we have prayed. Amen.
Thank you so much, Mrs. Charlotte Imprim, for this very powerful prayer. We would want to acknowledge the presence of Madam Felicia Dapa, the Chief Director of the Greater Accra Regional Coordinating Council, and a valued Z-Woman customer of the bank. We also want to acknowledge the presence of Dr. Mrs. Julia Padiki Derban, Deputy CEO of Total House Clinic, and she also runs the Women's Clinic in airports for Total House. Thank you very much. We also want to acknowledge the presence of Madam Mabel Norte, General Manager of Zenith Bank Ghana Limited, Mrs. Amelia Matefiu, Zonal Head of Zenith Bank, and our ESCO members, Daniela Gama and Mr. Kwame Adadi. The Zenith Women's Account was launched by Zenith Bank in October 2021, looking at 3 deliverables of enhancing the lifestyle of women, looking at financial illiteracy, looking at total and holistic health care, and also offering risk management products through loans to build up the business needs of our female entrepreneurs. The Z-Woman also seeks to hold annual as well as quarterly sessions where Zenith Bank partners with our female customers to ensure that they get the best out of banking with us. We also want to let you know that the link to signing up for Z-Woman, it's on all our social media platforms as well as our website. At this point, we want to invite Mrs. Mabel Norte for the opening remarks.
Good morning. So I have a speech prepared for me, so I'm just going to read that to you. Distinguished, amazing, awesome, wonderful, zealous Z-women. I'm sure you can tell I'm looking for all the positive adjectives to describe all you lovely women who have honored our invitation and you're here with us today. Our special partner and health talk facilitator and my friend, Dr. Mrs. Julia Padiki Derban, Deputy CEO, Total House Clinic, and your very able team. Invited guests, virtual participants, management and staff of Zenith Bank Ghana, and ladies and gentlemen, I would like to welcome all of you to the first edition of the Zenith Bank Z-Woman Breast Cancer Awareness Health Talk and Screening. The month of October is a very special one because it ushers in the clarion call that rallies the entire world to join in the fight against breast cancer. Zenith Bank Ghana is therefore joining numerous organizations around the globe to raise awareness of breast cancer through this health talk and create an avenue for women to be screened for 2 days starting today. Like Gloria said, about a year ago, we launched the Z-Woman, a product designed to increase financial inclusion among women, improve their entrepreneurial skills, and enhance their lifestyles. As part of the package, the Z-Woman will have access to key partnerships, exclusive discounts, credit facilities, periodic webinars and engagements on entrepreneurship, financial planning, beauty, health, such as what we're doing today, and many more interesting topical issues that will add value to what we do. If there's a time to be a Z-Woman, it is now. We have a lot of exciting things in store for you. But as you know, breast cancer is a very significant issue globally, affecting not only women, but men as well. We seem to forget that fact. According to an American Journal for Cancer Research article, it is the most diagnosed cancer in women, with an estimated 2.1 million new cases being diagnosed each year and representing 24.2% of all cancer diagnoses among women. Breast cancer accounts for 1 in 4 cases in women globally and contributes to 15% of mortality. Doc, I hope I'm right. It is important to note that generally, the factors that may account for this high cancer rate are relatively low awareness, screening practices or malpractices, and diagnosis. In addition, a 2022 article on factors that influence breast cancer screening among women of reproductive age in the Nandom municipality, Ghana, by Ward, Dodu, and Takan, noted that breast cancer is a major public health concern and the most common type of cancer among women in terms of mortality and incidence. Further, interestingly, 30% of breast cancer cases in Ghana are below 35 years, which may indicate a relative possible shift of cancer burden to women in their early 30s compared to Western countries. The publication also highlighted a few perceived barriers to breast cancer screening. Some of the comments from the women interviewed were, "I do not understand the screening process. I believe that's why we are here today. I'm afraid of a positive result." I think all of us are. But there's hope. "I do not know how to go about getting screened for breast cancer." I believe Doc will let us know. "It is too embarrassing to be screened." I can see some smiles. There's some truth in there, but I think the end justifies the means. "Screening procedure takes too much time. Health workers doing the screening are usually so rude." I don't think so. "Screening will expose me to unnecessary radiation." That's false. You haven't even started. "It is difficult to schedule a breast cancer screening. Breast cancer screening is not a priority to me. It should be. I'm too old to need a routine breast cancer screening, and breast cancer screening is too painful and expensive. However, you will agree with me that there's no excuse that would suffice for not undergoing breast cancer screening, as it is the tried, tested, and proven cornerstone of early detection. As the wise saying goes, a stitch in time saves. How many women are in Ghana? Okay, saves 9. That's what the saying goes. Early diagnosis of breast cancer can increase the chance of early case detection and favorable outcomes, resulting in improved survival rates and the quality of life of women and men. Therefore, this event comes at an opportune time and will provide the much-needed knowledge as well as the practical examination in the form of a screening exercise for the benefit of the Z woman. I would like to use this medium to encourage all women, and indeed all men, including those below the ages of 35, 40, to get the requisite knowledge about breast cancer and get screened. For those of us who are converts already, let us spread the word so that no one, no woman, no man is left out. This way we can save a lot of lives. As I bring my remarks to a close, I want to thank our facilitator, Dr. Mrs. Derban of Total House Clinic, for partnering with us. We trust that this will be a partnership for the long haul. I also wish to thank each woman. And at this stage, I want to go back to my plenty adjectives. Wonderful, lovely, beautiful, zealous, industrious women, the Z women. I want to thank each one of you who made time to participate in this event, both virtually and physically. It is our hope that you will pick salient learning points from the health talk that will be of great value to you, and you use this opportunity as well to get your much-needed screening done. Thank you so much for listening. God bless Zenith Ghana. God bless the Z woman, and God bless the women and men in Ghana. Thank you so much.
Would want to invite Mrs. Julia Padiki Derban to come and give us the health talk on breast cancer awareness. Thank you very much.
Good morning, ladies and gentlemen. So I think so much has been said about me already, so I won't even go there again. So like Mrs. Naughty said, October is the time we take our time to bring awareness for breast cancer. She also said, and which is very true, that breast cancer is one of the most common, is the first most common cancer in women. And now 1 in 4 women will get breast cancer. So it is that common. And like she said, hitherto it was the older woman who would see with breast cancer, but now we are getting younger women. We even have an 18-year-old who has had breast cancer. So now the onus is on us not to just wait till we are older before we do our screening, but we should start screening from now. Fortunately, the awareness is, in the outside world, the awareness is bringing the cases down. But in Ghana, unfortunately, it's not that, because like she said, there's so many things that we find wrong with going to be screened. So many myths and taboos about breast cancer. So we are getting to see our cases later and more serious than seeing them earlier when we could do something about it. So that is what the awareness is about, so that we let people know that if we find it out early, and we start treatment early, we can do something about it. But if you bring it late, there's not much we can do. Men also get breast cancer. 1% of cases of breast cancer is seen in men. And I tell people that it's not far, because in my short practice, I think I've seen about 4 in my maybe 30-year practice of medicine. I've seen 4 men with breast cancer, so it is not far away at all. Before I started, sometimes I like to let you know what the breast, a little bit about the breast, so that we understand what it is all about. So the breast is the gland, or what we call the mammary gland, which sits in front of our chests. In women, men also have breasts, but not as pronounced and not as developed as women. The primary function of the breast is to provide breast milk for our babies, to feed our babies when they are born. So the breast contains glands and things that will produce the breast, and the milk will come out of the nipple for the baby to feed on. Also in the breast, we have fatty tissue, we have what we call lymph nodes and lymphatic systems. All these things come to play when breast cancer is being diagnosed and being staged and being treated. The breast tissue is not just what we see here. The breast tissue extends into our armpit, and we call that the axillary tail. And we should all take note, because when you're examining your breast yourself, the axillary tail is very important. If you don't examine that part of the breast as well, then you're not done, because sometimes you can have the lump in the axillary tail or the part in your armpit and not even in the breast at all. So the axillary tail is also part of the breast. Now, what is the cancer process at all? We have to understand how the cancer process comes, and then we can relate it to the breast. Normally in our bodies, we are all made up of cells. I mean, the most minute thing in the body is cells. And these cells are the building blocks that make up the tissues, and then the tissues form the organs that we have. So the tissues will form the organ of the breast, the brain, the lungs, and all that. Normally in our lives, every time a new cell is formed, and the new cell grows through a time period, and then it should die. But for one reason or the other, we have not found out why. The new cell growth becomes haphazard, and the old cell doesn't die. So we are getting a lot of new cell growth, and the old ones that are there are not dying. And so they coagulate together to form what we call a tumor. As to why it comes, still science has not been able to find out why. So in the breast, when this orderly process of new cell growth and old cell death does not happen, then we get the lump in your breast. Normally, the lump, we have two types of tumors. We have the benign, that's the non-cancerous tumors, and we have the malignant tumors, which are the cancerous ones. I'm saying this because not every lump in your breast is malignant or cancerous, but we have to determine whether it is or not. So you can find a lump in your breast, but it may not be malignant. You can find a lump in your breast, it may be malignant. With the benign benign lumps or benign tumors, they are not life-threatening. They can be removed, and they hardly will grow back. And they don't spread to the surrounding tissue. So if you take it out, it may grow, but not particularly in that particular place. And it doesn't even spread to the other parts of the body, other parts of the breast or other parts of the body. However, the malignant tumors are serious and life-threatening. They can be removed, but they grow back. Because like I said, this haphazard thing has come up, and we don't know why. And then further on, they go to invade the surrounding tissues of where they are found and even spread into other parts of the body. So you would have had a small lump in your breast, which if nothing is done about and it's cancerous, it will grow bigger, it can even become an ulcer, it can become ulcerated, it will spread into other parts of the body through the lymphatics and the bloodstream. So into your lungs, into your liver, into your brain, into your spine. So at the end of the day, that little lump that nothing was done to it, it will kill you because of the spread. So you can come with maybe fluid in your lungs are all diseased, fluid, you can't breathe, and that will kill you. You can even come with a growth in your brain, where you start having seizures, you can go into coma, it will kill you. You can have this spread into your bone, into normally the spine, the vertebral column. It can cause paralysis because that growth there is going to press on your nerves that are coming from the spinal cord. So now you have breast cancer, but not just the cancer, but you're paralyzed. So that little lump has just moved into all these places, your liver, your lungs. The main places it goes to are the lungs, your brain, the liver, and to maybe the other side of the other breast. So that is why we are so concerned that that little lump can cause so much problems. This act of spreading from one part of the body to the other is what we call metastasis. And it becomes very significant when we are trying to treat breast cancer, because we need to know whether it has spread from that little lump to any part of the body. And that will determine what we will do. Like I said, we don't know why cancer comes, but with breast cancer, we have some risk factors. There are some things that puts us more at risk for getting breast cancer. The very first one is, unfortunately, we are women. So our gender puts us, that's the greatest risk we have, because we have the breast. If we didn't have the breast, maybe we would have been at 1% like the men. But because we have breast, that is our greatest risk. Age is a risk factor, but these days, like I said, we are getting it in younger women, so I wouldn't even put emphasis on that. If you have a family history of breast cancer, because there's some genetic predisposition. So if you have a mother, a sister, or a daughter who has not just breast cancer, but ovarian cancer, because they are related because of the hormonal aspects, then it puts you at risk. So you are even the person who should do more about it. Try to find out more and get more screening. If you also have a male relative who has breast cancer, it also increases your risk. Our reproductive history and menstrual history also puts us at risk. If you have not had children, or if you have not had a full-term pregnancy before the age of 30, it puts you at risk. I'll go on to explain this. If you've never had children, your risk is higher. If your very first period came at a very early stage, let's say, these days you see them, the children get it at 9, 10, but that it was like 13, 14 when we were going to secondary school. But if you have it very early, let's say below 10, it puts you at risk. And if your menopause, that's when you are stopping your periods, comes late, it also puts you at risk. This being, all these things go to show that there is a hormone which we call estrogen, and this is associated with all these things, and you're at increased exposure to the estrogen in all these things. If you don't have children early, you have estrogen playing in the major factor in your life all that time. When you get pregnant, the progesterone takes over, so then you have the balance. So if you don't have children at all, it means that you're just dealing with estrogen. The progesterone is there. I mean, they have an imbalance to go to, but as you get pregnant, the progesterone goes higher. And then if you have your first period very early, obviously, you're exposed to the estrogen all this time, and then late menopause. So the increased exposure to this hormone puts that at risk. It's more common in whites, that's what they say, but the problem is, for us blacks, we get the late diagnosis, so we tend to die more. Outside, they do the screening perfectly. You are called. I mean, the National Health System will call you. It's time to come for your mammogram. It's time to come for your screening. Unfortunately, we don't have such good healthcare and database here, so we are not able to screen effectively. So we tend to die more because of the late diagnosis. Other things that would be risk factors would be being overweight. And that is because there's an increased amount of estrogen that's produced in fat. So being overweight is also a risk factor. Hormone replacement therapy. Sometimes when we go through menopause and we find it so difficult to deal with, the doctors give you a little bit of estrogen to settle you a bit. That puts you at risk. So as much as possible, we advise that, don't worry, it's a phase. You go through it. It will end. If we can help it, we'll keep you away from the estrogen. Lack of physical activity, and that is not just for breast cancer, but all cancers because of the fat and this thing. And then alcohol intake. also puts us at risk. Smoking also puts us at risk, but that is not just for breast cancer, but major cancers as well. However, one thing that lowers our risk is breastfeeding. When the babies are breastfeeding, and I want to emphasize that I meant is the babies that are sucking your breast, not the fathers, not the men. So it's the babies sucking your breast, the breastfeeding, the act of breastfeeding produces other hormones, which reduces the estrogen levels. So breastfeeding actually reduces your risk. So we advise women, try and breastfeed exclusively for 6 months, but continue for about 2 years if you can help it. I know that these days we are working mothers and schooling mothers and everything, but let's try and extend the breastfeeding a bit because it also helps to reduce our risk. So how do you find that you have cancer? Or what are you supposed to look out for? More often than not, it starts as a painless lump. Painless. I want to say it again, painless. So that lump is sitting in your breast or in your underarm, your armpit, like I said, but it's not giving you any pain. So it's there. As it goes bigger, and then it distorts the contours of your breast. So you see that there's a change in the size of your breast, there's a change in the tissue, the skin. Sometimes it pulls the breast in, so your nipple, where hitherto was sticking, has now moved inside or become retracted. And then there's a distortion of it. And then if you squeeze your nipples, you may find blood. So a bloody discharge from the nipple is in fact, you should rush to the hospital if you see one. As it grows bigger, the breast becomes bigger, and then sometimes the skin changes to what we call the orange peel appearance, because now it's actually spreading into the skin. It's moved from that lump, and it's moving through the tissues of the breast into the skin. We emphasize on the screening because we want to find that lump before it actually causes problems. So that's what the screening is about. We ensure that the screening ensures that we look for the evidence of the disease before it causes problems, even before these changes I've said come up. And how do we find, and this is the key, this is key in finding breast cancer in its early treatable stages. How do we do this? We do by breast self-exam. That is the very first thing we need to know, that we should examine our breast ourselves. Because like I said, it's painless. It's a painless lump. If you don't touch your breast, you won't know it's there. So breast screening is not just us coming to examine. Yes, it's part of it, but it starts by a breast self-examination. So women are encouraged to examine your breast. I will go through it a little bit. And then we come to the clinical breast exam, which you can walk to a clinic and ask to have your breast examined, and then the mass screenings like we do. But the very key one is the breast self-exam, which every woman should endeavor to do. We advise you to examine your breast every month. For those who still have their periods, a week after your period is the best time to examine your breast. Reason being, at that time, the breast is softer, it's less painful, it's more comfortable for you to examine. We don't want you to examine your breast when it's painful and then you won't do it again. So, when I do it, it's too painful, so I won't do it again. No, a week after your period. For those in their menopause or who don't have their periods again, just choose a day in the month. So you can do it at the first day of the month or at the end of the month, but just try and do it on a regular basis, so every month. You start by standing in front of a mirror. So you look at your breasts, see whether there's any change in the shape, the size, the skin, and your nipples. So these are the 4 things you should look out for. And then you squeeze your nipples. If you notice any fluid coming out of your nipples, dab it with a bit of tissue and look at the color. White tissue, so you see the color. For those who've had babies or who are breastfeeding, or you may have some milky discharge. When you see it's milk. Or sometimes you even see a clear-colored, colorless discharge. If you're concerned, if you think that, oh, this is not what, I've never had this, why not come to the clinic? We'll have a look at it for you. But if you see blood from your nipple, you should rush to the hospital. So after looking at your breasts while standing, you then lie down to do the examination. So you are doing it yourself. Your right hand examines your left breast, and then vice versa. So if you're examining the right breast, you raise your right arm above your head. So you're doing this lying down. When you do this, your breast just falls out, and then you're able to examine your armpit as well. So when you do this, somebody please hold the mic for me so that, Joycelyn, come. So that I want to leave here and knowing that you've learned how to examine your breast yourself. So if your arm is above your head like this, so you're going to be examining this right breast. So you're going to use this part of your fingers, the flat part of your fingers, not like this. When you say people examine your breast, oh, well, when I examine like this, no, that's not what we want. We want you to lie down with your head down like this and press. You're going to be examining the breast tissue. Come this way so that the people here can see. Between your mid here, and then all the way here, and then from the collarbone right down to beneath your breast. So you're going to be pressing your breast tissue, right, between your fingers and your chest wall. So you can imagine that if there's something there, if there's a lump there, you will feel it. So if you press it, so you can do it from top, come down all the way to the bottom, come from the bottom all the way up. So you're pressing, right? So when we are doing for you, see how we do it. And then you all go all the way down, come, and then all the way into the armpits. Very important, right? So when you finish doing that, then you move on to the other side. Same thing, start from the top, press it. Just relax, don't rush. The breasts are yours. Don't rush through it, just take your time and examine it, yes. So as you do it, you go through like I've done and all the way into your armpit, and then you're done. The idea is that, if you can go and sit down, if you do it every month, or if you do it regularly, you have a feel of what your breast feels like. My breast may feel different from what Mabel's breast feels like, or what Gloria's breast feels like. But you should know what your breast feels like. So at any time you feel something you are not comfortable with, or you feel there's been a change, then please come to the clinic. Or just go to the hospital and tell anybody there that I have found something in my breast, or I'm not comfortable with something in my breast and I want it checked out. So breast self-examination is the key. That's what we want. That's how we will detect the cancer early. So once a month, 12 times a year is not asking for too much, isn't it? You can do it more than that. If you want to do it every day, I'll be happy, but I know you won't do it every day. But let us cultivate the habits of examining our breasts. Let us teach our children. Once they start getting breasts, teach them. Then there will be something with them for life. Teach your sisters, everybody, so that at any time there is any problem, we would know. So once we are done with the screening or the examination, other ways that we can screen are by doing what we call the imaging. So in the imaging, we use the mammogram or an X-ray, a specialized X-ray, which we use to also examine the breast to see whether there are any lesions that are cancerous or anything. We recommend that mammograms are done for only women who are 40 and above. Reason being, before 40, you are in your reproductive stage. It's not because of the radiation, but the glands are so prominent. So the mammogram does not give us a good picture. So we end up not telling us much. So as you grow older, the fibrous tissue that I talked about, the fibrous tissue in the glands and all that, the fat and everything, is becoming a little more, I'm sure you can see yourself. As you're growing older, your breasts are becoming less firm as they were. So it's easier and more beneficial for us to do the mammograms after 40. Anybody who hasn't done a mammogram at 40, please get one done now. When you are 40, give yourself a present, a birthday present. Go and do a mammogram. At least get a baseline mammogram done, and then we tend to tell you to do it every 2 years. There are some things that we find in the mammogram that the fingers cannot feel. These are what we call calcifications, and we see them in older people. So the mammogram is very important. Those who have examined my breast, there's nothing there, so I won't do a mammogram. Once you are 40, you have to do a mammogram, and then try and do it every 2 years. For those who, for those who are at higher risk, sometimes we do the mammograms when they are a little younger, especially if we find something that we want to actually diagnose, yes. But if for the screening mammograms, it's over 40 years. The mammogram, people will tell you, oh, it's painful, it's uncomfortable. Yes, it is uncomfortable, I wouldn't lie. It's a machine, it just squeezes your breast in a little, under a plate, let's say a plate, so it presses your breast this way, presses it this way, and they take the films. Just a little uncomfortable, just for a very short time. It's not something that you're going to go through pain for. Once they are done with the test or the screen, you are done. There's no pain that you get again. So please, let's not push the mammogram, doing the mammogram away and saying that it's painful and all that. Then we can also, apart from mammograms, we can do ultrasound scans of the breast. So that's another tool that we use to find solid lumps or fluid-filled lumps in the breast. So if we find anything, if you're not 40, we'll tell you to go and do a scan, and then so that we find out whether it's actually a fluid lump or a fibrous lump, or depending on whatever it is. After that, now we want to find out whether the cells of that lump are benign or cancerous. Any lump that is found in your breast should not be shoved under the carpet and say, oh, it doesn't look cancerous. No. Nobody can look you in the eye and touch that. Yes, we can say a little bit from experience that, oh, it feels like a fiber, but we should always have a look at the lump, the cells of the lump, to be able to say whether it's a benign lump or a cancerous, a malignant lump. These days, medicine is getting more advanced, so we don't even have to take the whole lump out, but we can do what we call a needle biopsy. So that lump that's sitting in your breast, guided by ultrasound, and then they can use a needle to go into the lump and take some of the cells out and send it to the pathologist. Right? So it can be done within a few hours. The pathologist gets the report. Within a few days, we have the results. If it's cancerous, we move. If it's not, and you want to take the lump out, we'll take it out. But once we are sure that it is not cancerous, the choice is yours. You can decide that, okay, I don't want to take, because sometimes, like I said, the benign lumps can grow back. So you can take, there are people who've taken like 4, 5, even 10 lumps out of their breast, and even more come. So if you decide that, oh, once we know it's not cancerous, and you decide that I've had enough, I don't want to take it out, that's different. But once that lump is there, we need to find out exactly what it is to be able to manage it. Sometimes we can even take the lump out itself, depending on, yes, apart from doing the biopsy, then we can also take the lump out, and then that also gives the surgeon the opportunity to have a look at the area to see whether there's actually been any spread to the areas and then all that. Now, once we take out the lump, it's found that it's cancerous, what do we do? Breast cancer is managed by a multidisciplinary team. It doesn't just go to the surgeons. There are plenty of people who have to sit down, decide on what to do for you, and go ahead with it. So the breast surgeon, the oncologists are the people who treat cancer, right? So the radiation oncologists and the clinical oncologists. We have the radiologists. Those are the people doing the mammograms, because we have to do other types of image. We have to see whether it's gone into your chest. You need to do a CT scan of your chest. Do you have any spread to the chest? You have to do a scan of your abdominal organs, whether there's been any spread. So all those people come as part of the treatment. A clinical psychologist, if you're told that you have breast cancer, it can be like a death sentence, but you have to be counseled and told what to. That's why people run away. They are afraid. I don't want to do this and that. But a clinical psychologist is part of the team. And then they counsel you, tell you what it's about, give you hope. Clinical pharmacists, because of the drugs they're going to be using, the pathologists I've already spoken about. Physiotherapists also are very important, because when you have a mastectomy, I'll come to that in a bit, when they take off the whole breast, Your arms can get swollen, and so you need a physiotherapist to help you with exercise and all that. And nutritionists will also tell you what you eat, get a good diet. And then we also have a breast care nurse who actually follows you up. At Kolebu, in the radiotherapy center, they run a breast clinic every Tuesday afternoon. And if you go there, that is when you see that breast cancer, it is real. So people in various stages of their treatment, some have had their surgery done, some are even having, sometimes because we can either do the surgery first, or we can start with the chemotherapy first, depending on the type of cancer, depending on the spread. Before they start the treatment, they actually manage each case per person. Because we have different types of cancer. Breast cancer. Some are very aggressive, some are a little slow growing, and then we have some hormonal aspects of the cancer process. So they have to do a series of tests to find out which one you are, some genetic aspects to have to be looked at. So it's looked at into person by person, that is what we call the staging. So the tumor node metastasis. Is it just the little tumor, less than a size? We have sizes that we grade them, and has it moved into another part of the body? The lymph nodes involved, has it moved to the other parts of the body? So the staging is done, and the treatment is scheduled accordingly, because sometimes you may have the chemotherapy before even the lump is taken off. Sometimes you may have the lump taken off before the chemotherapy. And then, depending on how it is, you can have not just the lump taken off, they can do what we call a wide excision, where they take a lot of the breast tissue out. That's if it hasn't spread so far. At least we try and get rid of all the places near that lump. Then we have the mastectomy, which is taking the whole breast off. Then we have the radical mastectomy, where we take off not just the breast tissue, but the muscles behind the breast tissue, because now it has spread there, and we don't, as much as possible, we want to get rid of the cancer cells before they cause more problems. And then they go and clear your armpit, all your lymph nodes. So you see the people coming with swollen arms and everything. So the treatment plan is normally discussed with the patient and the family member, and then we go on. Let us not be afraid that if you go to the hospital and they say you have a malignant lump, they are going to take your breast off. No, it can save your life. We have survivors. The good thing is that we have survivors. If we do it early enough, we have survivors. Sometimes what also puts people off is the chemotherapy. The chemotherapy are very strong drugs that we push into your system to kill the cancer cells which have moved away from the lump. Because that's why the lump, that area, we are taking it off with the breast. But the other cells that have gone into the other parts of the body, the chemotherapy will take care of it. Unfortunately, the drugs are so strong, and they work on quickly multiplying cells, because like I told you, the cancerous cells are quickly multiplying. And so unfortunately, they also kill other cells, normal cells in the body, which are also quickly multiplying, like your hair. So when you go through chemo, you lose your hair. That's one of the main things that the women that we have, yes. But once you're done with the treatment, your hair will come back. And these days, we have all sorts of wigs and things that we can put on. So if you don't even have hair on you, nobody will know. You see, so that shouldn't be a pushback, yes. It's a very rigid thing a strict regime, because it's not just one treatment that you go today, they give you the chemo and you are done. You do it in cycles, and it depends on the type of cancer, depends on the staging. So you may do it in cycles, and then when you are done, you go on to do radiotherapy. So it is not just one-off treatment. So that is why we want to find it early. If we find it early, we take the lump off, and we follow you up, and you don't have any spread. They'll keep on following up and everything. Then at least you don't go through all these things. Or even if you go through it, at least you'll be followed up and you can live. We have survivors. Let me just come. I have a little statistic that at least gives people hope. So in Kolebu, the breast clinic, the 5-year survival post-treatment at stage 1, stage 0 and stage 1. So stage 0 is just that little lump, which was found to be cancerous, but it hasn't spread anywhere. Stage 1, if it's is bigger than 5 centimeters, we have a 92% chance of 5-year survival post-treatment. So that if it's done early, that 92% of survival for 5 years is there. Once you survive 5 years, I'm sure you survive more years. Stage 2, when it's now not just the lump there, but it's moved into the lymph nodes, maybe the lymph node in the armpits, one lymph node, that's stage 2. So it's bigger than 5 centimeters. You find it in the armpit, that is stage 2. And then that is about 60% 5-year post-survival treatment, 5-year survival post-treatment. Stage 3 is when all the lymph nodes in your armpits have been affected, and that gives you 34%. Stage 4, it means it's moved from the breast. It's gone into, we have metastasis in either the brain, the liver, the lungs, the spine, and that is only 15% of survival. So if you bring it late, obviously, there's not much we can do. But when you bring it early, if it started early, there is hope. So just to, in a glance, like I said, breast cancer is the most common cancer in women. Between 1 in 4 women are likely to get breast cancer. The causes we don't know, but I've listed the risk factors. We diagnose it by self, that's you are examining yourself and you find the lump, or a physician examines your breast and finds it, or we do mammogram, ultrasound, and the biopsy. There are many types of breast cancer that differ in their capability of spreading. Some are very aggressive. You see it today, within 3 months, it's a totally different thing. So the person sees a lump today, I think it's nothing. Within 3 months, it's totally different. And then it's recommended that women at the age of 40 should have a baseline mammogram. And then hitherto, every 2 years, try and get a mammogram done. Let us be breast aware. Let us not get frightened, but rather enlightened, that at least we know what to do. Early diagnosis gives us a better prognosis. If we find it early, we can do something about it. And breast cancer can be cured, but only in the early treatable stages. So please, ladies, let us examine your breast. Let's not just let the Pink October go without us learning anything. Let us go back, examine our breast, teach our children, our sisters, our mothers. Some people don't even know about it, but it does kill. So on this note, I would like to say a very big thank you to the Z Woman and Zenith Bank for giving me the opportunity. I'm very passionate about breast cancer screening. I've been doing for probably the last 20 years, and breast and cervical cancer screening. So it is one of the things that I do. Every October, I go around and talk. Even when it's not October and you come and you want your breast examined, why not? So on this note, I would like to say a very big thank you. If there are any questions, contributions, anything, I'll take them on. Normally when I finish a talk, everybody's quiet because it hits home. You know, for me as a doctor, I mean, it hits home to me because I've seen people die of breast cancer, even people who are close to me. So please, are there any questions?
So please, you can also put your questions on Facebook or Zoom for Dr. Derban to answer. We are live and interactive.
Okay.
Please, I wanted to find out how true is it when you have a benign tumor and then the doctor tells you there's a chance that if you get pregnant, it might melt it out. How true is it?
This is it's nothing. Once you have a lump in your breast, if it's not taken out, it will stay there, as if it's benign. It will not melt. It's fat. It's fat and fibrous tissue, so it's not going to melt and go anywhere. It will still stay there. So, once you've brought pregnancy in, yes, sometimes we find the lumps when the women are pregnant. So even if you are pregnant, please examine your breasts. Yes, and even when you are breastfeeding. Yes, because sometimes we actually find the lumps when they are pregnant.
Thank you, Doc. You kept saying that we're not sure what causes breast cancer, but I think over time I hear people say that the usage of microwaves, contributes to getting breast cancer, and in fact that is why a lot of women are getting it here in Ghana. So, is there any link at all? Should we believe it or just take it as a myth?
I would say that, the rays that are coming from the microwave are not significant. I'm sure Auntie Mabel even mentioned that, yes. It hasn't, as for the waves, they are all over, right? As to why we are getting it, we don't know. But putting it to the microwave, I don't think that we should take it. We should take it with a bit of a pinch of salt, yes.
Thank you, Doc. Is it true that most cancerous cells, breast cancer included, multiply with pregnancy?
Yes, it's possible because, when you are pregnant, with breast cancer, like I said, the progesterone levels are higher. With pregnancy, yes. So it may actually not become worse, but if it's there, it will just, like I said, a cancerous lump starts as a cancerous lump. Maybe let me put it that way. So that you don't get a benign lump which becomes cancerous when you are pregnant. But it would be there, it could be there if when you are pregnant, it wouldn't be made worse, but it will just be there like any other cancerous lump. It will still grow if you don't do anything about it, yes. So pregnancy really, the progesterone is actually supposed to protect you, but if it's already a cancerous lump there, it will just grow as a cancerous lump.
Thank you, Doc. I also like to find out, there's a myth that when food is kept and reheated in plastics, especially maybe you're cooking cassava or something, you cover it with some plastic, or there's banku wrapped in plastic when you preheat it in a microwave or on fire, whatever is plastic covering food, once your food is in that state and you eat from that sort of plastic, it has the tendency of causing some sort of cancer. Is that true?
Well, obviously there are some chemicals in the plastic, right? Like I said, since we don't even know what exactly is causing the disease, that's why we try and advise that these days I think the polythene bags, they are even advocating that they are of a particular type and all that, yes. So because of the chemical in it, let us try and avoid chemicals in our food. If you're going to heat it, I think you can just cover it with a lid and not actually put it. I won't say it's actually linked to breast cancer itself, but it's possible that, obviously chemicals may have a link in all the cancers we have, yes.
I'll take some questions from the online platform. So Sandra wants to know where she can have a cervical cancer test done, the pap smear you spoke about.
Well, anywhere. Total House Clinic, we do pap smears. Trust Hospital, Ridge Hospital. Is she in Accra?
Yeah.
Ridge Hospital. You can walk into any of the clinics. These days, it's done fairly easily, yes. So she can come to Total House Clinic, airport. I'll do it for her.
Okay. Thank you very much. Hilda wants to know how abortion relates to breast cancer. And also, if your breast is bigger and reducing whilst growing, does it have any link to breast cancer?
Abortion, I said, if you don't have a full-term pregnancy before the age of 30, full-term means that you are going to be exposed, your exposure to estrogen is going to be low. Abortion, obviously, you've cut it into two. I mean, you didn't get to the full term. But that's if it's your first pregnancy. But not, I wouldn't say that regular abortions would increase your risk, no. But if you haven't had a full-term pregnancy before the age of 30, and that is your first, yes, that increases your risk. But I'm not sure that if you've had a child before, another child, and maybe you go and have an abortion, it shouldn't increase your risk. But let us not have abortions. Let us plan our pregnancies. Yes, use family planning and decide on when you want to have the child and not get pregnant. Then the other question was...
Gina wants to know how you are... Okay, so the other one from Hilda was, if your breast is getting bigger and reducing whilst growing up, does it have any link to breast cancer?
Normally, we all should realize that one breast is a little bigger than the other. That's the way we are. But an excessive increase in size of your breast should alarm you, or an excessive reduction in the size of your breast should alarm you. Yes, because sometimes the breast, the lump is sitting there and it actually retracts your breast. So instead of your breast actually filling up, it's actually becoming smaller. I mean, with the tree word, you know, it shrinks, yes. Maybe let me use that word. So the idea is that look at the changes. If this is what your breast is like, fine. But if there's been an excessive or there's a significant change, yes, then you should let us know.
To know how you are able to tell the difference between the natural lumps in the breast and any other lump that grows.
Any lump in your breast, unless the biopsy is done and the cells are determined, we can't actually tell you whether it is cancerous or not. But sometimes, you can, in fact, I wouldn't even want to convince anybody to let you get convinced that, oh, this lump is cancerous or not. You need to have it checked. You can do the scan. The scans will tell you whether it can tell you to some extent that, oh, this is a fibrous lump or it's a fluid-filled lump, which we call the cysts. Yes, because if there's fluid inside, the scan can tell you. But the most important thing to do is have the cells of the lump checked. So biopsy, it is definite that you have to do a biopsy. You have to have those cells in the lump checked out before you can tell whether it's cancerous or not.
So Gina goes on to ask, he also mentioned that when a lump is benign, you can decide to leave it in the breast. Is it possible for a lump that was previously benign to become malignant?
Not at all. If it's a benign lump, it will stay a benign lump. If it's a cancerous lump, it will start as a cancerous lump. There's no change from one to the other, no. So that's why I said that if we are sure that it's benign and you've had it checked, they've done the test and it's a fibroadenoma, which is a benign one, and you don't want to have more scars on your breast, that's fine. But it doesn't move from one to the other. No, they don't change. It doesn't mutate from a fibrous lump to a malignant lump and the other way around.
All right. Good morning, doctor. I just wanted to find out, since we said that men can also have breast cancer, do the procedures for checking, etc., still follow exactly the way the women go about it, and how often should they be checking? I mean, in relation to the women, how do the men go about it?
Yes, even for men, I think it's even easier for you because your breasts are, they are not, they are there. Once, as soon as you look in the mirror, you see what it is. And then, yes, touch it. Examine your breasts. So the same way, just a man, we won't let you do a mammogram because obviously it's easier to diagnose a lump in a man's breast than a woman because obviously their breasts are not well defined. They're pronounced, yes. But the same thing, yes, let us be breast aware. Men and women, look at your breasts. If you see any change, if you are not comfortable with anything, please let us see, especially with the men, the nipples, the nipple is affected quite early because it's so close to the breast tissue, yes. So if you find any change in the nipple, you see any difference, please come over.
Thank you, doctor, for your presentation. At what stage, I'm looking at senior high school, at what age is it advisable to introduce girls to this kind of discussion?
Once they have breasts. So anytime, once they have breasts. So puberty. And this is, like I said, puberty starts from about 11. Once their breast tissue develops, you should make them aware of the need to examine their breast. Because that is, for the children, it's even better because then it becomes part and parcel of them. So they know that once they start having their periods, they should examine their breast. So, and their breasts form when their periods also come, so around the same time. So as for the children, we can start as soon as they reach puberty. Any other questions?
Yes. Good afternoon. So I once watched on TV where a lady was predisposed to breast cancer because of her family history. So what the doctors advised that they took out the tissues even though she didn't have any lump or anything in her breast as a preventive measure. How realistic is that?
Yeah, it's realistic. If the breast is not there, then the lump will form. I'm sure this woman, there's this actress, yes, she's had a bilateral mastectomy because the gene factor was so strong. So she's finished having her children, or if she doesn't want to have children, she'd rather take the breast off. Once the breasts are not there, you can't get breast cancer. It's a little harsh though, but in the outside world, they do it. Yes, it's still a form of mastectomy. They're taking the breast tissue, but they do a reconstructive. Yes, maybe let me just even also come here that when we do the mastectomy, for people who go through the mastectomy, we have the ability to reconstruct their breast for them so that at least they can look presentable, they can wear their dresses and all that. Yes, so they take out the whole breast, but the skin, sometimes the skin is removed, or they can even use skin from other parts of your body and reconstruct a breast for you. Put in the silicone implants and then reconstruct the breast. If you don't want that, or if that is because it's expensive, we have what we call the breast prosthesis. So it's an artificial breast, but it feels very soft. It has a nipple and everything, and you just slip it into your bra. So although you're flat on that side because the breast has been taken off, if you put the prosthesis in and you wear your bra, even if somebody touches you, the person won't even know that it's artificial. And they come in different sizes, so they actually give you a size that will match your other breast so that so that you feel comfortable about it, yes. Okay, thank you very much again, and we'll be doing the breast examinations for you I'm sure Gloria will tell you more about it. Thank you so much.
I want to say a very big thank you to Dr. Mrs. Derban for this very insightful talk. So Zenith Bank, in partnership with Total House Clinic, is holding a 2-day breast screening exercise starting immediately after this talk. We have 2 rooms, one in the annex just outside of here, and we also have the mobile clinic downstairs behind the annex where we can go and then have our breast examined by the medical personnel who are here to undertake this exercise. We would invite Jessica to give us the vote of thanks.
Thank you very much. Ladies and gentlemen, we want to thank God, first of all, for giving us the opportunity to be alive and to be part of this very important session. We want to thank the management of Zenith Bank for making this possible. It's not easy to sit through this talk, but by the grace of God, I believe we know what to do. So we want to thank our fellow colleagues for taking time off your very busy schedule. It's end of month, but it's also important for you to come to go through this. So thank you very much for coming. We want to thank our customers, most importantly, the reason why we are here, for taking time off your busy schedules as well to come here. So thank you very much and have a beautiful day. Thank you. Forgive me. Thank you so much, Dr. Derban. Thank you very much for explaining and making it comfortable for us. I know after this talk, most of us would also fight the fear and go and get checked. Shall we rise and share the grace, please? May the grace of our Lord Jesus Christ, the love of God, and the sweet fellowship of the Holy Spirit be with us now and forevermore. Amen. Surely, his goodness and mercy shall follow us all the days of our lives, and we shall dwell in the house of the Lord forever and ever. Amen.
Photograph session, and then we'll be announcing the order of photographs, so please don't leave. It will not take more than 5 minutes. The first photographs will be with the facilitator, Dr. Mrs. Derban. Members of ESCO and the facilitator will take the first set of photographs. So, members of ESCO with Dr. Mrs. Derban. Okay. Please, will all members of MANCOM kindly join for the next set of photographs? Okay. Okay. Can we please have all invited guests kindly join ESCO for the pictures? Can we have all staff present also kindly join our facilitator for the pictures? All staff, if we can join for the last picture, please.
Even the guys in the streets can do that. So what makes a bank special? What do people want when they open a bank account? Could they be looking for a relationship built on trust? Offering prompt, flawless, and innovative banking services. A partnership that understands their dreams, goals, and is ready to invest in it. They want to be told it's possible and be guided to make timely decisions to secure their future. A bank that will always be in proximity. A bank in their best interest. Since its incorporation in 2005, Zenith Bank Ghana has cultivated a reputation for delivering innovation, excellence, and great customer care. Zenith Bank Ghana is a Tier 1 bank and among the top 10 biggest banks in Ghana. It is a subsidiary of Zenith Bank PLC, the biggest bank in Nigeria and one of the 10 biggest banks in Africa, with global presence in West Africa, the Middle East, Far East, and Europe. Zenith Bank Ghana has 40 business locations, comprising of branches and agencies spread across the nation, and a digital presence across the country. At Zenith Bank, our pillars of people, technology, and service have enabled us to deliver a host of personalized and corporate banking solutions that guarantee convenience and security. Services such as retail banking, trade and treasury services, custodian services, corporate banking, e-banking, and a wide range of card services. A bank's culture of excellence is built on the bedrock of an astute management, highly motivated staff, state-of-the-art IT infrastructure, strong corporate governance, and regulatory compliance. We are passionately desirous of an opportunity to commence a mutually beneficial banking relationship with you. Talk to us today for an unrivaled banking experience. There was a time when people didn't see the need to put their money in the bank. They said at the bank, you can grow your money. Even the guys in the streets can do that. So what makes a bank special? What do people want when they open a bank account? Could they be looking for a relationship built on trust? Offering prompt, flawless, and innovative banking services. A partnership that understands their dreams, goals, and is ready to invest in it. They want to be told it's possible and be guided to make timely decisions to secure their future. A bank that will always be in proximity. A bank in their best interest. Since its incorporation in 2005, Zenith Bank Ghana has cultivated a reputation for delivering innovation, excellence, and great customer care. Zenith Bank Ghana is a Tier 1 bank and among the top 10 biggest banks in Ghana. It is a subsidiary of Zenith Bank PLC, the biggest bank in Nigeria and one of the 10 biggest banks in Africa, with global presence in West Africa, the Middle East, Far East, and Europe. Zenith Bank Ghana has 40 business locations, comprising of branches and agencies spread across the nation, and a digital presence across the country. At Zenith Bank, our pillars of people, technology, and service have enabled us to deliver a host of personalized and corporate banking solutions that guarantee convenience and security. Services such as retail banking, trade and treasury services, custodian services, corporate banking, e-banking, and a wide range of card services. A bank's culture of excellence is built on the bedrock of an astute management, highly motivated staff, state-of-the-art IT infrastructure, strong corporate governance, and regulatory compliance. We are passionately desirous of an opportunity to commence a mutually beneficial banking relationship with you. Talk to us today for an unrivaled banking experience. There was a time when people didn't see the need to put their money in the bank. They said at the bank, you can grow your money. Even the guys in the streets can do that. So what makes a bank special? What do people want when they open a bank account? Could they be looking for a relationship built on trust? Offering prompt, flawless, and innovative banking services. A partnership that understands their dreams, goals, and is ready to invest in it. They want to be told it's possible and be guided to make timely decisions to secure their future. A bank that will always be in proximity. A bank in their best interest. Since its incorporation in 2005, Zenith Bank Ghana has cultivated a reputation for delivering innovation, excellence, and great customer care. Zenith Bank Ghana is a Tier 1 bank and among the top 10 biggest banks in Ghana. It is a subsidiary of Zenith Bank PLC, the biggest bank in Nigeria and one of the 10 biggest banks in Africa, with global presence in West Africa, the Middle East, Far East, and Europe. Zenith Bank Ghana has 40 business locations comprising of branches and agencies spread across the nation and a digital presence across the country. At Zenith Bank, our pillars of people, technology, and service have enabled us to deliver a host of personalized and corporate banking solutions that guarantee convenience and security. Services such as retail banking, trade and treasury services, custodian services, corporate banking, e-banking, and a wide range of card services. The bank's culture of excellence is built on the bedrock of an astute management, highly motivated staff, state-of-the-art IT infrastructure, strong corporate governance, and regulatory compliance. We are passionately desirous of an opportunity to commence a mutually beneficial banking relationship with you. Talk to us today for an unrivaled banking experience. There was a time when people didn't see the need to put their money in the bank. They said at the bank, you can grow your money. Even the guys in the streets can do that. So what makes a bank special? What do people want when they open a bank account? Could they be looking for a relationship built on trust? Offering prompt, flawless, and innovative banking services. A partnership that understands their dreams, goals, and is ready to invest in it. They want to be told it's possible and be guided to make timely decisions to secure their future. A bank that will always be in proximity. A bank in their best interest. Since its incorporation in 2005, Zenith Bank Ghana has cultivated a reputation for delivering innovation, excellence, and great customer care. Zenith Bank Ghana is a Tier 1 bank and among the top 10 biggest banks in Ghana. It is a subsidiary of Zenith Bank PLC, the biggest bank in Nigeria and one of the 10 biggest banks in Africa, with global presence in West Africa, the Middle East, Far East, and Europe. Zenith Bank Ghana has 40 business locations comprising of branches and agencies spread across the nation and a digital presence across the country. At Zenith Bank, our pillars of people, technology, and service have enabled us to deliver a host of personalized and corporate banking solutions that guarantee convenience and security. Services such as retail banking, trade and treasury services, custodian services, corporate banking, e-banking, and a wide range of card services. The bank's culture of excellence is built on the bedrock of an astute management, highly motivated staff, state-of-the-art IT infrastructure, strong corporate governance, and regulatory compliance. We are passionately desirous of an opportunity to commence a mutually beneficial banking relationship with you. Talk to us today for an unrivaled banking experience.